Jonathan, right? Yes, sir. Good to have you, Jonathan. Good afternoon to everyone. Thanks for joining us today for our daily update on the COVID-19 national emergency and state emergency that we're all experiencing. I'm joined today by Secretary Nate Smith as normal, but we're also joined by Secretary Stacey Hurst, who will talk shortly about our parks, our state parks, and our outside recreational activities. And I was previously joined by Director A.J. Gary, who had to leave because he's got a few other things going, including responding to the tornado in Jonesboro. So he's got two crises on his hands, and I appreciate his work as well. Yesterday, as we reported, we had 426 COVID-19 cases in Arkansas. Today, we have 473 cases, which is an addition of 47. We have 62 who are hospitalized, and we have one new county, which is Arkansas County. In addition, we have an additional death that's added to the total, so we have now seven deaths as a result of COVID-19. And again, Dr. Smith will provide more details. I'm going to turn it over to him for his comments, and then Secretary Hurst, and then I will follow that with two announcements today. Okay.
Thank you, Governor. I want to give a little bit more detail on our numbers. As the Governor has mentioned, we did have a jump up of 47 to a total of 473. The breakdown between male and female remains about 60% female, and our racial distribution is about the same, 74% white and 15% African American. We have 17 children aged 18 or less, 149 older adults 65 years and older, and 307 aged 18 to 64. We have, as reported yesterday, 6 pregnant women. We have 37 who have diabetes, that's +1. Heart disease, 36, that's +4. Chronic lung disease, 22, that's +1. We still have 10 with chronic kidney disease, and we were +1 to 12 on those with immunocompromising conditions. We have 71 that we know were related to domestic travel, that's up 2. 73 who are healthcare workers, that's up 6 from yesterday. As the Governor mentioned, we have 62 hospitalized. That's up 19 from yesterday. That's a substantial jump. Remember, yesterday we had a slight decrease of 5. We have 47 in nursing homes. That's up 4, and we now have an additional nursing home that has a case. So we are up to a total of 5 nursing homes. We have 21 who are on ventilators. That's up 5 from yesterday. As the Governor mentioned, we will have 1 additional death. This is an individual who's over the age of 65, and this was our first nursing home related death. We have 29 who have recovered. That's up 29. We have 1 new county, Arkansas County. A couple things I want to mention briefly. Question has come up to me about sports activities, outside sports. Outside sports activities are just fine as long as you can maintain that at least a 6-foot distance. Again, if it's a tennis match, for example, that's fine. Just before and after, don't start coming so close together that you then spread the virus between you at that point. So sports, other outdoor activities are great as long as there's a healthy, at least 6-foot distance between individuals. State parks, Secretary Stacey Hurst is going to talk more about that. Great place to do something during this time. Outside is great. There's plenty of opportunity to be spread apart, good ventilation, UV radiation from the sun, which inactivates viruses. But again, be mindful. Don't stand so close together when you're waiting to go on the trail or whatever. Out-of-state travelers, we have states around us that have some hot spots in them, and we have to be mindful. And especially at our state parks, those are enjoyed by people from our state, but by people from other states as well. Just be mindful that the people around, you need to do social distancing so that you're not at risk of COVID-19, potentially from an out-of-state traveler. There's a question that's come up about this prohibition on social gatherings of more than 10. And I think that's a good rule. It's a directive, and it is designed to protect the people of Arkansas from transmission of COVID-19, but we need to be thoughtful and mindful about how we apply it. 10 or less is not all the same. If they're 10 of your family members who you're around all the time and none of them are sick, that's one thing. If you're standing shoulder to shoulder with 10 people from 10 different states who you don't know, that's a different thing altogether. It only takes one person to transmit COVID-19 to the other 9. So even when you're in smaller groups and outside, still keep that healthy distance, at least 6 feet, to prevent transmission. With that, I'll turn it back over to the governor.
I kept listening for the words basketball. I didn't hear it in his comments, but that's very practical counsel, health advice that you've given. Secretary Hurst, I've asked her to be here to talk about our state parks, and we've had some concern about congregating in our state parks, people wanting to utilize the outdoors, and ask her to point up the actions that have been taken.
Thank you, Governor Hutchinson and Secretary Smith. Parks are currently open, but we have taken pretty extensive measures to reduce the risk for our visitors and our staff. A couple of examples, all of this is listed on our state parks website, but a couple of examples for you today. We have closed lodges. We have limited camping to RV, self-contained RV units only. We've closed bathhouses, and visitor centers at state parks are largely closed. Museums and exhibits are closed. We've also moved to a contactless check-in system for camping, and so that will reduce the contact between visitors and our staff. We want to continue to provide this valuable resource to the public, but we need everyone to take very seriously the responsibility they have to help flatten the curve and reduce the spread of the virus. The number one thing people need to do is practice social distancing. Even though you're outside, you need to avoid congregating in groups, and we hope that will not continue to happen. Our state parks team of rangers, interpreters, and the superintendents will be driving around and monitoring such activity, such congregating. So they will remind you of your responsibility to practice social distancing. Thank you.
Thank you, Stacy. And now let me make 2 announcements, but let me give you a little background first. Previously, the state allocated $30 million to acquire protective equipment for those in the front line. Doctors, nurses, medical professionals, healthcare workers, and first responders. That $30 million has allowed us to move forward on the supply chain, to lock in some of the supply delivery dates so that we should be receiving those fairly shortly, as well as what we've received from the national stockpile. But based upon the demand and the need that's out there and projecting the future, that $30 million investment in protective equipment is not going to be sufficient to last us through this crisis. And that's very clear. So based upon what the legislature did in creating the COVID-19 Rainy Day Fund, I am announcing the approval of $45 million in additional funds to go toward purchase of the personal protective equipment. In addition, the purchase of ventilators as they become available in the marketplace. We have to allocate those funds in advance in order to be able to get in the supply chain. And we're looking not just what we need tomorrow and 30 days, but we're having to look at what we need 60 days down the road. And I want to thank the General Assembly, particularly Speaker Shepard and Senate Pro Tem Hendren, for setting up this fund and for their quick response in approving this emergency measure. And so that's $45 million in additional fund to go to those, the protective equipment that is so much needed by those in the front line. Secondly, let me give you a little bit more background of our challenge here. I was on a call with the President earlier today, as well as other governors and the Vice President. Clearly their focus is on the hot spots from New York City to California to New Orleans. And so as they're having to devote an enormous amount of resources to those venues, it makes it even more challenging for states like Arkansas to get in that supply chain. We can place an order, and as I've said before, the Department of Defense might come in and say, well, we need that. Or it might be New York offering a premium. And so we're having to compete on a very difficult marketplace. I spoke with one supplier today and said his demand is 64% more than his capacity to produce. And that's a seller's market. They dictate the price, they dictate the terms to a certain extent. So we're having to work in that environment, and we're doing it by the state being engaged in larger purchases so that we can compete with the others that are around the country and internationally looking at the acquisition of same thing we're trying to acquire. The second announcement I wanted to make today was that under the CARES Act, the federal legislation that Congress passed, the states will receive federal funds to help meet the needs of this crisis. And this is a very significant amount of money that will be coming into Arkansas. You can see the significant need because I've just recited $75 million just in short-term acquisition of protective equipment. And so we're going to have a significant amount of federal funds coming in between now and the end of the year. Actually, it'll come in sooner than that, but it'll have to be allocated between now and the end of the year. So today I've signed an executive order setting up a 15-member steering committee made up of my administration and 6 members of the General Assembly in order to guide and shape and make recommendations on the use of the federal money as they come in. This will be a steering committee that will work between now and December 30th. Their duties will expire because that funding at that point will expire as well. The members of the General Assembly were appointed based upon recommendations of the Speaker and the Senate Pro Tem. And I look forward to that steering group helping to guide us as we allocate funding in the future for the emergent needs that we have. With that, be happy to take any questions.
The fiscal year, sir, or the calendar year?
Calendar year. And so the funds actually should be available from the feds within the next 30 days, but it has to be spent between March 1 and December 30th calendar year.
How much in federal funds?
Well, we anticipate $1.25 billion in federal funds.
This money could be used to fill the budget holes in the
No.
budget?
It states that it will be used for costs related to the COVID-19 crisis, and we're looking for further interpretations, but I do not anticipate that that can be used for filling the holes in the budget, even though, you know, the postponement of the tax deadline and the filing deadline is the result of the COVID-19 crisis. So we're still looking for some clear guidance on that, but I do not anticipate that.
What kinds of things do you think that might be spent on?
Well, it's going to be used for the acquisition of hospital beds that might be needed, the ventilators, respirators, the equipment that I've identified, And the length of the acquisitions is undetermined because we could have this summer, this spring issue with COVID-19, and we don't know what's going to happen next year with it. So part of it could be the current crisis and meeting the needs and costs, but it also could be looking to the future and how we deal with this might be with us next year and what we need to do in preparation for that.
I know a lot has been made about the nurses and doctors in the state, but are you guys doing anything or looking into doing anything for EMT workers? For like ambulance and those kind of guys?
Yes, I'll let Dr. Smith articulate where they are on the priorities, but we're very mindful of that, and we know that they need this equipment as well. But you want to address that more clearly?
Absolutely. EMTs are, the whole emergency medical services are part of our priority system. Obviously, we've not had as much PPE as we want, we need, but they're definitely a priority there. And since we license them, we're in close communication with them, but we can give specifics. I don't have those numbers with me. I can give specifics, though.
Are you guys looking to doing the same thing with nurses and doctors in terms of the licensures as you are with EMTs as well?
Oh, in terms of licensures, in our state we have a lot of people who are licensed as EMTs who are not actually working as EMTs. So I think we've got a good pool of people to draw upon, but I'm not sure I'm understanding your question exactly.
I think it relates to the fact that we expedited the licensure of some nurses, physicians. In fact, that number has gone up in what we did with the nurses. And so we will look in that licensure requirements for the EMT, and if there's needed, we'll certainly try to expedite that. That's something that we'll measure the need and what we can do to increase the capacity for those in the field.
Restrictions.
Let's do here and then back to Mike.
Restrictions on casinos expire tomorrow. Is that right?
They will be extended. Mike?
Dr. Smith, since there was discussion at the national level about projections of deaths, do you guys have projections on deaths for Arkansas?
We don't have a formal projection on deaths for Arkansas. There's a lot of things that go into that equation, and we are still learning in the U.S. what we should estimate as our case fatality rate, the proportion of those infected who ultimately die. Probably a more practical ratio is the number of hospitalized individuals who will not make it. And I think that's going to be different in the U.S. than it has been in some other countries. So yes, we've been looking at deaths as an estimate, but we don't have a formal projection.
Question on testing. The New York Times compiled some data, and it showed that Arkansas is one of the 5 worst states for per capita testing. How do you feel about that, and what's keeping us from doing more testing?
Well, I'd like to see that article, and that actually surprises me because we have really worked early in terms of developing of our testing capacity, and it's expanded. I will acknowledge, as every small state that's not New York or California or Illinois or New Orleans, that every state that's not a hot spot is struggling to get we have the equipment. It is to get the testing kits that we need to able to do the testing. And so that is our challenge. That's why I was on the phone with multiple labs today saying, can you move us up in priority in terms of getting those testing kits? So we rely upon the private sector labs. We rely upon UMS has developed a capacity we didn't have before in testing, but they're struggling with the same way to get the testing kits. Then our Department of Health have had actually to go to manual processing of the lab tests because we don't have the kits to do our automation and the faster acceleration of the test. And so, yes, we have challenges that some other states don't have because CDC, the vendors, and others have put priority on those hot spots. We do believe that we'll continue to improve that, and we can measure a lot of different, measure the hospitalizations, measure our current testing, but we do want to be able to increase that capacity. Dr. Smith, did you want to add to that?
I think I would want to see the numbers on that. We actually really have done quite a few tests. If you count Department of Health, now UAMS, and also the commercial labs. I know there's some of our neighboring states that are in a much worse situation. One of their state labs basically completely ran out of reagents, and so this is a problem that's across multiple states, not just ours. But we're struggling with it. Just because of supply chain issues, but I don't have any evidence that it's worse here than it is in many other places.
Do we have any indication of this backlog we're hearing about actually analyzing those tests, how many were waiting to get analyzed in the state of Arkansas? For example, Sebastian County last week had 13 negative tests for a week. Saturday it jumped to 23. Do we have any indication how many tests are waiting to get analyzed?
Well, the backlog is not at the Department of Health lab, and it's not really even at the UAMS lab. It's with some of the commercial labs. I know LabCorp and Quest were some of the first to announce that they were going to be doing this kind of testing. I think they just got flooded. They operate really across the country. I think they got more samples than they could possibly do. I think they had reagent issues. Quest for a while stopped doing it. Now they're back on again. Some of the smaller ones have had pretty good turnaround time. We've gotten results from them within 2 days. So it's not the same across all the commercial labs, but depending on which lab a hospital or a clinic was sending to, they might have significant backlogs with that commercial lab.
Number of how many tests were waiting to be analyzed in the state of Arkansas?
Unfortunately, I have no way of knowing the samples that have been sent off and have not yet been analyzed, because we get those, we find out about those at the Department of Health when the lab results come to us. We have, for the most part, electronic laboratory reporting.
Should people be playing basketball? The governor brought it up, so.
I think if the governor wants to play basketball by himself, and preferably outside, I think that'd be perfectly fine.
And I want you to know I am doing that by myself outside. You can see me practice a little bit. But I've given up my Friday game with 10 people, full court basketball, and that's probably, well, that's a vacuum in my life, but we give up things, and that's important.
Based on the numbers that you've seen so far and the models, projections, such as they may be, do you see any point, or are you considering strengthening your directives, your recommendations regarding groups, gatherings?
We measure it every day. Dr. Smith and I look at what we need to do based upon the data that we have. And as I said yesterday, ours rate of hospitalization cases are not accelerating the rate we see in other states. Obviously, we're going to continue to measure that. So we look at it every day and what we need to tighten up, but I think we're doing the right thing right now. I also want to say that we continue to look at our modeling, and I hope that tomorrow we'll have an update on where we are and where we see us going. Yes?
Could I ask, on the nursing homes, what was the new nursing home, and where were the new residents at who were tested positive?
In terms of details on the nursing homes, we did have a single case at a nursing home in Paragould, Green Acres nursing home, and we will be testing, as we with the others, we have a plan to test all the residents and all the workers there, but so far we just have the one positive resident. We have had some additional cases. We had 2 additional cases at Whitehall, and the others have remained the same.
How many is that now in Whitehall total?
Total of 6 in Whitehall.
Any additional employee?
We had an additional employee at Whitehall, and that is the only additional worker that we've had since I reported yesterday.
Just 1 employee at Whitehall total?
Yes.
Do you know if any of the infected nurses were wearing protective gear? Or any healthcare person?
Yes. I don't have information on that. I know that all the places that have cases now, the workers have been trained and provided what they need to protect themselves, but these exposures likely occurred before the first case was identified.
Of the recoveries, do we know how many people were on ventilators at one point?
In terms of total that have been on ventilators, I have that information, but I don't have it with me at this point. I'll come back with that information later. Thank you.
But babies keep arriving. This may be plowed ground, I don't know, but anything special emphasis on for our advice, suggestions for women who are carrying or whose delivery may be imminent, and then on the neonatal side as well?
Fortunately, we haven't seen worse outcomes in pregnant women who are infected with COVID-19, nor have we seen a particular risk to their babies, but we're watching that very carefully. We don't have a lot of experience with that. There's been some press about women coming in who are pregnant and then not being symptomatic for COVID-19, but then later testing positive, and that can occur really with anyone. Someone can come in to the hospital without symptoms, but actually be incubating infection. But at this point, we've not seen correlation between COVID-19 infection and adverse pregnancy outcomes, but we're watching that very carefully.
Will you be releasing information if someone tests positive from a high contact area like a Walmart, grocery store, gas station?
Absolutely. If we get our contact investigation suggests a large exposure, then we'll take whatever appropriate actions are. If it's a situation where we can directly contact the individuals who have been exposed, we do that because that's the most effective way. If it's a setting where we can't, then we would put out a press release so that those who did have that exposure could come forward.
You got an update on the unemployment claims that have been filed in the state, and how's that system still working?
We had over 30,000 claims that were filed and processed up until this weekend, and so I don't know what the latest number is today, but I do know that there's still an excess demand in terms of being able to get through our telephone lines, and again, we call on people to be patient. We're trying to upgrade our IT system. We're working very hard on this. We've brought in extra resources and personnel to process those claims and to answer the calls. But we'll continue to monitor that.
Any fresh data from DFNA on collections?
So we got a report coming up soon. So our April report will be out in a matter of days. Again, there's no indication that this month's collections will be off target because we're 1 month behind, and so the first month impact will be next month. So I anticipate this month that we will be fine.
Are you expecting, I mean, we're sort of in unprecedented times. Are you expecting to have a revised fiscal year 2021 budget to present to the legislature on the first day of fiscal session?
I met over the...
Is that going to take a while?
I met over the weekend with Secretary Walther and his budget team, and there will be a need to revise next year's budget. And let me get my language right. Be a need to revise the revenue forecast. But the budget that we've presented is based upon the Revenue Stabilization Act, and that should work fine, even though the revenue forecast might be lowered, and it will be lowered to some extent. So we haven't got those exact numbers. Secretary Walther will release that whenever he has that action.
Will that be before the fiscal session?
That should be before the fiscal session. One last question.
And with so many people currently waiting on unemployment benefits, we're hearing from a lot of people concerned at the beginning of the month, possible eviction notices. Are you considering anything as far as prevent eviction notices during this time? People concerned, what do you want them to know?
I expect landlords, bankers to act responsibly and compassionately during this time, and everything I have indicates that they are. If we see problems out there or unfair behavior, then we will take another look at that. But I think the marketplace is working as it should with compassion under these circumstances, but we'll continue to look at that and see what needs to be done in the future.
If we decide we're at the peak at some point, say 6 weeks down the line, and we start to see a significant drop-off, when do you decide to say that we can go out and about again? What is the lesson from China or wherever you're getting your ideas about?
Well, that you don't want to release too quick. And so that's something that is really based upon the guidance of Dr. Smith. We'll be listening to him, the national experts as well, and make those judgments as we need to. Thank you all very much.